say that the Affordable Care Act, better known as Obamacare, is off to a bad start is a gross understatement. Many people feel Obamacare is a complete disaster. Clearly, a majority of Americans feel it's a bad idea. Millions of insurance programs canceled, costs spiraling through the roof, and some people not getting treatment for life-threatening situations. Today, I want you to meet some of the victims of Obamacare. This is serious stuff, so stay with us. Dr. Bob Berger is an orthopedic surgeon and sports medicine specialist who's been practicing private medicine for 23 years. He's the head physician with Xavier University and has also consulted with the Cincinnati Reds. Dr. Berger recognized the pros and cons of America's healthcare system before the Affordable Care Act. And while he does see the positives of Obamacare, its expensive costs and cancellation of plans don't bode well for the future. And while he does see the positives of Obamacare, the president's misleading statements and the millions of canceled plans don't bode well for the future. So what would you say then, the pros and cons of Obamacare in their attempt to address the problems with current healthcare issues?
The two biggest issues that I think the intent where the letter of the law did do it is, number one, stopping coverage to an individual who has a pre-existing or serious medical illness or condition. And the second thing was access.
But to that statement, I've read that 5 million people are losing their health care as a result of Obamacare.
It's 5 million and probably counting. And what happens is that a lot of their insurance plans, and these are insurance plans that in most instances the individual was happy with, they were ACA non-compliant plans. And so those plans became terminated, and some of those plans were required by law to provide benefits that weren't in the letter of the plan. For example, every plan has to have acupuncture. And again, you or I might decide that we might not want to pay for acupuncture as part of our plan.
Or a 60-year-old woman who has to have maternity care.
That's correct. Yeah. So I think the whole notion of, well, if you like your health care plan, you can keep it, that's a really, at the very best, naive, at the worst, a tremendous misleading statement for the president or anyone else to make in healthcare.
Insurance agent Stephen Tucker has been in the health insurance business for 20 years. He writes a blog dedicated to the overall effectiveness of Obamacare and analyzes the law's ramifications and impact on businesses and consumers. One of the greatest problems he's seen is the high costs and unaffordability of new healthcare plans.
First stream of negative reports was the 6.3 million people who have lost their health insurance policies. That's a big negative with Obamacare. And the only reason the entire individual market hasn't been canceled is because some are grandfathered, meaning purchased before March 23, 2010 when the healthcare law passed, and Barack Obama illegally, unilaterally, and unconstitutionally acted by fiat to stop the rest of them from being canceled by waiving the provisions in the healthcare law through the midterm elections and all the way through 2016, to get all those Democrats reelected, right? In order to push off the worst parts of this so the rest of the individual market could actually keep their old policies. But that in itself is going to leave what we in the industry call a death spiral. Because the reason they got rid of all those policies is because most of those people are young and healthy. Who do they need to subsidize the older and sick? The young and healthy. So let's just cancel their policies so they're forced to buy the more expensive dental plans. And it is not affordable to anyone who does not qualify for an APTC, Advanced Premium Tax Credit, AKA a subsidy. Those of us who don't qualify for that, our deductibles are double, our premiums have gone up as high as 42%. There's nothing affordable about Obamacare unless you qualify for a subsidy.
When we return, we'll hear how Stephen helped a man living with cancer regain his canceled insurance. Dr. Bob Berger and insurance agent Stephen Tucker recognize the positives associated with the Affordable Care Act. It's increasing access and addressing the issue of people with pre-existing conditions who are denied coverage. However, the system needs young and healthy people buying into the exchange. Otherwise, issues with Medicaid reimbursement costs and the loss of Medicare dollars will result in fewer options for people with chronic conditions and senior citizens.
The increased access comes in two ways. Number one, it did broaden the outreach, so now patients who are up to 400% of poverty levels are eligible through Medicaid programs. The challenge with Medicaid is that of all the insurers, Medicaid is by far the poorest reimburser. The challenge that physicians have is our reimbursement rates have dropped 25% in the last 13 years, and yet the costs of doing business go up 5 to 7% a year. All these patients in Medicaid, they're going to have a very difficult time finding a primary care physician. The second scenario is that individuals can, in many instances, receive some subsidies through the federal government to enroll on a health insurance exchange. The problem with the exchanges is while it might have been noble in intent to have the exclusion of pre-existing conditions, that model breaks down if a lot of young, healthy individuals don't sign up for these health insurance networks. Because in our country, 84% of the health care services are directed and allocated to patients with chronic conditions.
I would say the most egregious is what's going to happen to our nation's senior citizens. Most of your policy wonks talk about Obamacare cutting $500 billion from Medicare. And yes, Obamacare does cut from Medicare. That is a fact. $136 billion in the first 10 years is to Medicare Advantage, which is Part C, which is a very popular program for our nation's seniors. This year it's going to cut even more from Medicare Advantage. According to the Medicare Actuaries report, Medicare will be paying out more than it is paying in for the first time in U.S. history. Intelligent solutions have to be pursued to save Medicare for future generations. They are on the table. They are already being used, and this administration is flatly rejecting them.
Bill Elliott is a retired government medic and biological weapons instructor who was diagnosed with cancer in 2008. Over the past several years, they've found numerous tumors in his colon, thyroid, and spleen. In the midst of fighting his third bout of cancer, Bill received a letter from his insurance company stating that due to his catastrophic pre-existing condition, he would either be dropped from his plan or forced to pay an extremely high premium and deductible. After finding no affordable options through Obamacare, Bill decided he wasn't going to put his family through this financial burden.
I got a registered letter from my insurance company saying, look, you have, catastrophic pre-existing conditions and you've filed too many claims and we're just gonna have to drop you. Or we're gonna have to raise your premiums and your deductible up from like $180 a month to $1,500 a month and a $13,500 deductible. I said, well, I cannot do that. I cannot pay for that. I'm not going to burden my family on that. So what I'm going to do is just let nature take its course, and I'm not going to play it. If I die, I die.
And the reason you got this registered letter was because of Obamacare?
Yes, because they were saying it was going to cost them more money, and the money that Obamacare was, the subsidiaries, was not going to cover it.
What did your kids have to say about that?
Oh, they was devastated, everybody was. And I said, well, I don't know what I'm gonna do. I mean, I'm not gonna pay $1,500 a month. I was kind of discouraged, and I voted for Obama. But now, every time he gets on TV and does a press conference, within the first 5 minutes, if he don't say, I'm resigning, I cut the TV off.
You've lost all confidence in him?
All confidence in him, and in fact, the whole left side.
Bill's story ended up on the Fox News channel where he was interviewed by Megyn Kelly. Although he had voted for Obama in 2008, he felt betrayed by the president's false promise of, if you like your plan, you can keep it. Luckily, Steve Tucker saw Bill's story and was able to inform him about a protection within the HIPAA law that prohibits cancellation of insurance while being treated for an illness.
First thing I said to Bill was, we're on opposite sides of the political aisle, but I just want you to know the president's been lying to the American people for 4 years. It is illegal now, and it has been illegal since 1997, for any health insurance company to drop your coverage when you're sick. That law is Public Law 104-191, and the section in that law is Section 2742. Those of us who are not policy wonks refer to Public Law 104-191 as HIPAA law. When most people think of HIPAA law, they think of privacy. They're not aware, and neither was Bill, even though he's in the medical field, that there was a provision in the law that protects people from having their health insurance canceled or their premiums increased based on claims. So I knew this. I sent him the link and said, please contact your governor, send this to your insurance company, because what they're doing is violating federal law.
He sent me the stuff and I read it over and I said, man, you just saved me. You have just saved me. I'm just going to send this right now to my insurance company, Governor Haley, and between Nikki and Steve. Within 8 hours of the next day, they was calling me up telling me, just don't worry about any of this. Your coverage will stay the same. If it wasn't for those two and a few other people, no, I'd either been dead now or broke.
When they righted the wrong, did they say they were sorry? Or?
No, of course not. No. They just said, okay, what you provided us was true, that we can't do this.
But that won't stop us from trying with the next Joe, huh?
No, that's exactly right. And in fact, I knew several other people who went through the same situation that I did. And I said, wait a minute, let me give you some information. And they got their insurance back as well.
After you were able to help Bill, what was his response?
It was wonderful. He said, Steve, they called me, my policy's back, you literally saved my life. And I gotta tell you, to this moment, it still gets me emotional because I don't think I've ever done anything so great in my life, other than the birth of my daughters. Because here's a man who was at his wit's end. And the thing is, I've been screaming from the rooftops for ever since then and before that what they're doing is illegal. But at least I was able to help one person.
In a moment, we'll hear from an Ohio businessman on how the implementation of Obamacare is affecting his business and employees. Tony Moss is the president and CEO of JTM Food Group in Cincinnati, Ohio. His father founded the company in 1960, starting it as a family-owned butcher shop and growing it into a business that now employs over 400 people. JTM is also known for its openness about their religious faith and family values. Tony knows healthcare is essential to his family and employees and has always offered healthcare benefits. But with rising costs and extra taxes of Obamacare, he's finding the insurance more and more difficult to afford.
Even before that, things were kind of out of hand. But now the mandating of what they're doing, for us already offering health care, it's extremely more expensive. The extra tax they're putting on you, of paying more money in that way too. So it's definitely raised, our health care has gone up between 25 and 40% every year. It was $1 million more last year than the year prior.
Is it getting to the point where it's threatening whether you're able to offer health care to your employees?
Everything gets to a point where it becomes cost prohibitive. We are constantly trying to find ways that don't burden our people. I mean, it's just terrible. When you can think about somebody who is, from our line labor making a $12, $13 an hour job, at JTM, and they're earning $25,000, $35,000 a year. My cost of health insurance on top of that is around $12,000 to $15,000 a year. So almost more than half of what they make, I'm also spending in health care, and at some point in time it becomes cost prohibitive. So we're constantly trying to work with other businesses and other HR firms and other insurance companies, everything, trying to figure out a way to try to make it more affordable.
Have there been any positives with Obamacare?
No.
None at all. What are some of the negatives you've experienced with Obamacare?
It just continues on with the cost prohibitiveness of it. But again, as a Catholic, the type of things they're saying you have to cover, And again, the recent ruling with Hobby Lobby, we're still trying to get to the bottom of that, because for a lifetime, we've always made sure that anything to do with abortion is kept out of our insurance plan. So that is extreme negative as a moral perspective. I got to be true to God before I am to the government, and that really puts us into a extreme difficult position. And that's something we bring through our entire business. We are very transparent in our faith here. We let our company, our customers know what we're about. We are free to put pictures of babies on the back of our trucks and say life is what a beautiful choice, because why wouldn't you? You know, being a Christian business and a pro-life company and pro-family, that's what the world about, and who wouldn't want to do business with somebody like that?
Well, has the Hobby Lobby decision affected JTM Food Group? And if so or not, what is your status right now?
Abortion is not covered. Right now, I mean, that's what the insurance companies have assured us, that the abortion is not covered. And some of the contraceptions that are out there are not covered also, that lead to abortions.
Well, the fact that you're not covering abortion in your health care policy, what do you attribute that to? Because
we are being very proactive in it. And I think we have obviously put our foot forward, and we've been given every assurance that it's not covered. The Hobby Lobby issue has helped because that has been not enforced, I would say. It was definitely part of their mandate and their law, but from what I gather, they are not enforcing a company that is aware of abortion being covered, or a company that doesn't want abortion to be covered, by us saying, no, we don't want it covered, and because the law might be murky to some, we've been able to keep that out of it. I would have to imagine the Hobby Lobby lawsuit, that obviously the victory happened recently. There's many more companies than myself that have great pause on the idea that we're going to do something against our faith and cover that. You know, health insurance is in the medical business is trying to save lives, not to kill lives.
Coming up, we'll hear advice for people who lost their insurance due to the Affordable Care Act. The high costs and millions of canceled insurance plans make a strong case against Obamacare. But Steve Tucker doesn't want people to give up hope. He reiterates the importance of having insurance and working hard to find the most affordable option to suit your individual or business needs. Steve, what would you say to others who are struggling with a canceled insurance policy and trying to find a policy that they can afford?
If they have pre-existing conditions, since our state risk pool options that existed long before Obamacare are now being dissolved, I highly encourage them to buy health insurance, preferably off the exchange. All health insurance policies are guaranteed issue, on or off the exchange. Buying health insurance off the exchange is a wonderful experience. It takes you 5 minutes, no health questions, it's jet issued 5 minutes later. It's that wonderful.
Go and look at Steve's in the HIPAA laws from '96, see if that applies to them, and if not, find the best way they can to get insurance.
What do you see for the future of health care in America? Some have actually said that it'd be better if we didn't have health care insurance.
I couldn't disagree more. I have seen examples over and over again. One of them I'll share with you. I still have the letter in my office, and it's from a gentleman who remained unnamed, who from 18 to 31 years of age, uninsured. Didn't have health insurance since he was on his parents' policy. He was buying health insurance, and he pulled up the chair and said, hey, listen, I'm thinking about getting married. She thinks I'm a knucklehead because I don't have health insurance, I don't have life insurance. She said, I need to get my act together. So he bought a policy, it was $98 a month. About a year and 3 months afterward, he contacts me and says, I'm vomiting blood, it's my wedding day. I have to go to the hospital. Finds out that he's been diagnosed with leukemia. The last time I looked at his payouts for his claims, and this is going back to like early in my career, it was $642,000 that the insurance company paid to save his life. So everybody should be insured. The worst part about Obamacare is that after we spend $1 trillion in new taxes over the first 10 years alone, $2.6 trillion in total costs over the first 10 years alone, we're still going to leave 31 million people uninsured. There were so much better ways to do it than Obamacare.
Would my assumption be correct in that, in your opinion, it would be better if Obamacare hadn't been enacted?
It would be. It would be naive, and it would be very short-sighted for someone to say we didn't have problems. And those problems needed to be addressed. We have less numbers of uninsured patients, but the patients that have insurance are going to feel underinsured, and they're still going to have a difficulty being able to pay for the insurance they have. On top of that, we've created a massive new federal bureaucracy to deal with the problem. And I think we're all just beginning to realize, what's the full extent of the law, and especially how that law is being executed and carried out.
The advice for those small business guys that these extra burdens are being put onto them, stay vigilant. We need new entrepreneurs, because it's America. Entrepreneurship is key and critical to America. And there's so many burdens that the government puts on you, especially this healthcare. Try to make it as affordable as you can. So I just continue to encourage people, despite those hurdles, keep moving on. For those that have been blessed to have grown their businesses and are at a different stage of having a lot of employees, know what's in those healthcare insurance. Please don't allow things that are anti-family and anti-life to be part of those insurance plans. And then stay vigilant in the political process to make sure we get our country back to where it needs to be, where freedom is front and center of all we do.
Join us next week for part 2 of this in-depth program. You'll learn how the Affordable Care Act is affecting our nation's standard of care and resulting in fewer choices and competition when it comes to physicians and healthcare plans. You'll also hear how my guests feel about the unchecked power of the executive branch and how businesses may respond to prohibitive costs. Plus, we'll reveal a shocking story of government intimidation against Steve and Bill. You won't want to miss it. For more resources to better inform you about Obamacare, visit our website at facinglife.tv. While there, find out how you can order a copy of this special 2-part episode on DVD and Blu-ray to share with others.